My wife Ann and I moved here about 5 years ago. Ann's a singer-songwriter. She's been doing a lot of writing. We live One Health every day, I guess you'd say, because we have a very close community. I'm on the board of our community health center. I have an office overlooking the water. It's just a wonderful spot, and we feel very privileged to be here. Studied epidemiology, joined the government in about 1990. I went into research management, ran a number of projects, started working for the Canadian Veterinary Medical Association. SAVI, which is the Stewardship of Antimicrobials by Veterinarians initiative, was launched out of these initial workshops to develop a project that built on the guidelines that CVMA already had in place in hard copy form and transfer them to a web-based platform. As we moved through the project, we saw an opportunity to work with the University of Calgary to develop an app. We also wanted to do work on antimicrobial use surveillance, and we decided to focus on the prescription level. So we were really interested in harvesting data on what vets were prescribing.
I wish it had been available 20 plus years ago. I've used a lot less until I get sensitivities in cultures for bladder infections, for instance, because not everyone is actually a bladder infection. They just peed a little more frequently for some reason that day, and we come back and it's normal. And so I've used a lot more just anti-inflammatories until I get those results and haven't needed antimicrobials or can target them more specifically.
We milk 67, 68 cows right now, and then we have all the young stock, which start at one end of the barn, go down to the other.
The First Line app can be used for a number of species of animals, including dairy cattle, beef cattle, poultry, swine, small ruminants, sheep and goats, and horses, as well as companion animals. So for mixed practitioners who are seeing a variety of species, sometimes not that frequently, having a point of care app is very useful.
The big thing is preventive medicine by like early vaccination, and so I think doing all those things like through the vets as well, that you automatically will reduce the amount of antibiotics that you need. So I think human health is the end result.
We can't solve problems unless we collaborate, and by doing that, as I've tried to do through the projects I've been involved with, you can have an impact that ripples across the country and across the world sometimes. So thanks to the organizers for the award. Hold on to